Hello, everyone, and welcome. Welcome now to my live Q&A. Sorry, I just had to adjust my screen. Live Q&A. I am Dr. Andrew Neville. We're going to talk about adrenal fatigue and everything that it is connected to, all the misinformation and poor information, misunderstanding, and everything that's involved with it. Adrenal fatigue is connected to so many different conditions. And yes, indeed, it does exist. It is a thing. So stick around. If you have any questions as you join in, please, by all means, put them in the comments and we'll try to get them. I tend to run off of a document where we've got a bunch of questions that have already been submitted. So we're going to go by that list. But as you join in, let us know also who you are, where you're from. We have patients all over the country, and even some international patients these days, which is awesome. The information about adrenal fatigue and certainly the care of patients with adrenal fatigue is lacking just about everywhere, not just here in America. So we're trying to reach as many people as we possibly can. I should say that this information is for information purposes only and does not equate to medical advice. By all means, check with your doctor before you make any changes or do anything. Whoops, sorry about that. With regard to your care. What else? So I've got this list of questions. I'm going to go off that list of questions. Basically the purpose of this is just to make this information as accessible as possible to as many people as we can. There's a ton of information, much of it's generic, and a lot of it's just flat out wrong, unfortunately. We've been doing this for over 20 years after having suffered from adrenal fatigue myself. So we want to clarify as much of that misinformation as we possibly can. And without further ado, I think that's what I'm going to do. I'm going to jump into to these questions. As you join in, welcome everybody. And please let us know where you're from on whichever platform you're on. We love to hear that. My team is manning the comments, so I'll be guiding you there, here and there, as well as we move forward. Fantastic. Okay, so we're going to jump in. Daniela says, as I understand it, the stress system works too sensitively, which leads to all the different symptoms from fatigue to anxiety, panic attacks, sensitivity, pain, stomach. I should probably check to see if we're good to go. Oh, we are good to go. Oh yeah, by the way, if you're a current patient, some of my current patients will jump on here as well. This conversation is much more so for the general public. If you have a question, I appreciate you submitting it, but reach out to our team or save it for the part of the program that you're in, and we can get into those specific questions. Okay, sorry. So Daniela, hypersensitive stress response system leads to all these symptoms, including continuing pain, stomach problems, racing heart, sleep problems, and much more. And the doctors give all these symptoms different names: depression, anxiety disorder, burnout, PTSD, fibromyalgia, POTS, and then try to fix the symptoms and find different causes like Epstein-Barr, Lyme, herniated discs. But all the symptoms come from the body stuck in fight or flight mode, and we have to bring it back down to rest and digest like a thermostat. Correct? ? Absolutely correct, Daniela. I couldn't have said it better myself. That's a great summary of exactly what happens. Which also means that you add all of these diseases together, a lot of people actually suffer from a stress system disorder. You're right. There's a lot of people that are suffering from a stress response system disorder. Just look at depression. Depression is the number one leading cause of people seeking disability these days. And probably 9 times out of 10, this stress response system dysfunction is connected to that. The connection between stress leading to depression is very powerful in the research. Any doctor worth their salt kind of knows that connection. Combine that to people with hypertension or diabetes or all the immune system disorders, everything you described. Yes, there are a lot of people who are dealing with that. So Danielle's question is why, but what are we doing wrong? Or what have we done wrong to get this far? Other people have lots of stress. Why does our stress response system work like this? Sorry for the not so good English. Greetings from Germany. Well, greetings to Germany. Thanks for showing up. Your English was perfectly fine, probably a little better than mine. So what are we doing wrong? Probably be easier to answer what are we doing right. Our stress response system was designed a long, long time ago, before the modern life that we have going on these days. It was designed more for hardship, right? Things like, plagues and famines and predators and things like that, right? More hardship, not necessarily the stresses that we're dealing with these days. These days, we have so many things that are coming at our stress response system on a minute to minute basis, if not not just a daily basis, that it's easy to overwhelm the system. Just look at the toxins in the environment. Toxic exposure of any kind, these man-made toxins are stressors. They do stress the system. The body has to respond to those in the same way. There's thousands of man-made toxins on top of technology and how busy we are, and you name it, politics, social media, all this stuff kind of overloads our system, and it compounds. We have research that shows that you could look at the stress of a woman as she's carrying a child, and you could predict the stress-related disease that child will have in adulthood. There's something called epigenetic change that goes on even in utero for a lot of us. So a lot of us have been born and our stress response system is already trigger happy and already sensitized. And then you throw us into this kind of crazy world that we live in these days. And it's easy to overwhelm that system. Now, everybody's born into the world with a certain size bucket of tolerance for stress, right? Some small, some big. Thing is, you can overwhelm anybody's bucket if you throw enough at them. And that bucket, our whole lives are in that bucket, basically. And a lot of the research talks to this and uses terms. One of my favorites is called allostatic load, which is the body's response to all these various stresses over time. And that allostatic load kind of fills up our bucket. Most of us are on overload, unfortunately, which just tips our physiology into fight or flight. And we can hang all of our organs somewhere on this physiologic seesaw, which is why the effects of, what we'll call adrenal fatigue, right, which is really the entire stress response system being dysfunctional, not just the adrenals, it affects everything. I mean, it literally does affect everything, and it concentrates, but it is fixable. It is fixable once we know what we're dealing with, right? We know we're dealing with this hypersensitized or broken stress response system. We can take action to actually fix it instead of, putting Band-Aids or kind of quick fixes over the anxiety, the fatigue, the pain, the weight gain, the depression, the blood sugar issues, right? Kind of treating symptomatically is like putting a little piece of tape over the check engine light in your car. I mean, you might not see the warning light anymore, but you haven't fixed the problem, and it's going to get worse over time, right? So if we avoid doing that, if we avoid chasing after the secondary problems, all the immune, digestive, reproductive hormone problems, thyroid hormone problems, if we focus our attention at fixing the broken stress response itself, the hormones, the nerves, the limbic system in the brain that calls the shots, we fix that system and target it in a comprehensive, holistic way, you can absolutely fix it. And incrementally kind of get back on your feet, symptoms go away, turn on the healing and repair side of our physiology, and get on with your life. It just takes a kind of a comprehensive and a kind of a bird's eye view at what the problem actually is. So keep listening, and hopefully you'll get some tips on how to do that. Thanks, that's a great question. Jenny says, wondering if near-infrared light can help adrenal fatigue. It is touted to improve mitochondrial function. Also wondering about HBOT, so hyperbaric oxygen. Might that help? They might. I mean, I'm aware of the research on near-infrared light and mitochondrial function. Certainly the mitochondria, which, so for everybody listening, The mitochondria are the little energy producers in all of our cells, which unfortunately are very vulnerable to stress physiology, directly hit with stress hormone, and then the metabolic exhaust of being in fight or flight, like running from tigers all the time, just like your car exhausts, the body exhaust. That exhaust is in the form of free radicals, and too many free radicals overloads our oxidative or contributes to oxidative stress, damaging our mitochondria. Now we can't produce energy. I don't use infrared light to fix mitochondria, but I am aware of some of the research, and there's some benefit. Certainly, we always have to fix the mitochondria. I'm not aware of hyperbaric oxygen for this. I can tell you that I don't use those methods to treat my patients, and they get better. But there are certainly options out there. Julie says, do you think that safety in every form for the body and the mind is a key to healing, or is there something more technical that has to be done? Yeah, safety is a key to healing. When our body feels safe, right? Our body, our mind, when we feel safe, we are in more of a balanced physiology, if not more in a parasympathetic physiology, and that feeling of safety is quite important. We know from research on childhood trauma, and abandonment and things like that especially in kids, that lack of safety is really key. It kind of keeps us on red alert all the time. And again, when we're on red alert for whatever reason, right, whether it's childhood trauma or those toxins I talked about, or any stressor as our bucket fills up, when we're on red alert, our body starts to anticipate, our stress response starts to anticipate stress. And especially in the limbic system, it gets sensitized and trigger happy, right? So it takes less and less to trigger our stress physiology. Those of us with this condition, we tend to make mountains out of molehills, right? So minor stresses don't generate a minor response anymore, right? Minor stress, major response. And that sensitization has us filling up the bucket even faster. All fixable. You can fix all this, but again, you can't just target the adrenals. You can't just target the nerve side of the stress response system or the limbic system. When you target it all as one, because it all works together, 100%, you can fix it. So safety's a piece of it, right? But there's more to it. Brianna says, I'm just starting your treatment. Do I need to reach 100% health before I can become pregnant? Or can I still do the treatment of healing occur while I'm pregnant? Thanks. So you don't have to necessarily get to 100% health and resolution before you get pregnant, but you do want to pay attention to the fact that pregnancy is a stress on a woman. I don't know if you've been pregnant before, Brianna, but I'm sure people around you have been pregnant. And if you talk to those people, they will definitely say that process is not without stress. And we know that when a woman is pregnant, her cortisol levels are jacked up, among other hormones, right? But her cortisol levels are elevated during that time. So it is a period of stress. So really, I guess if we had to conceptualize, like, when is it okay? It's if we're going to add pregnancy to your bucket, right? We want to make sure there's enough room in your bucket that you can handle that added stress. Now, it's hard to kind of quantify that, right? That's the challenge. But it's not necessarily just the stress of pregnancy, because after you're pregnant, now you have a baby. And I love my children, but they did not decrease the stress in my life, nor for my wife. So it's, so having a newborn and having, somebody at your ankles for many years afterwards is additional stress. But you don't have to be perfectly well, just improving, and I would say significantly improving makes sense, so that there's enough room in your bucket to be able to handle that. And if you're in one of our programs, you're going to learn tools and techniques to not only, we have to create space in the bucket, right? And there's basically three ways we create space in this bucket. We want to scoop out what we can. If something doesn't have to be there, let's eliminate it temporarily, mitigate it, control for it. So that's one way. What we also want to learn to do is poke as many holes in this bucket as we can, because life is not without stress. We have a stress response system because we're meant to deal with it and tolerate it. It's actually been the reason we've survived and adapted over the thousands of years that we've been here. So we need a certain level of stress to optimize function. But we don't want it to accumulate, right? So poke as many holes in this bucket as you can, techniques and things that you'll learn with us. And then we want to expand the bucket. So let's expand the bucket to your greatest genetic capacity, right? Which is a little more of our job, targeting the various aspects of the stress response system. Let's fix that thing, calm it down, settle it down. And all those actions create space in that bucket so that then you have more tolerance for the world that we live in. Okay. Good luck with all of that as well. Stephanie says, hi, Dr. Neville, is adrenal fatigue actually a problem with low functioning adrenals, or is it more of a brain signaling problem from the hypothalamus and the pituitary? In other words, has the brain put a governor on the amount of adrenal hormones available as a type of preservation mechanism since the stress response was overused for a long time? It's a good question, Stephanie, and the answer is yes to all of it. To all of it. Can it be low adrenal function? Yes. Can it be there's a governor, right, and the HPA axis is dysfunctional? 100%. In the research, when we look at the PhD level research on stress and stress physiology, there's actually all kinds of things going wrong. And that's one of the main reasons I'm not really crazy about the term adrenal fatigue, because it's a bit of a misnomer. There are glucocorticoid or glucocorticoid receptor changes, hypersensitivity or desensitization. There's HPA axis dysregulation. Indeed, there is hypocortisolism, low cortisol from the adrenals. That does happen, but there's also dysautonomia involved in this as well, a dysfunction with your autonomic nervous system. And then, those changes in the brain, because the puppet master of the hormone side and the nerve side of stress physiology, which basically tells the body to do what we need to do, fight or flee, it's all controlled by that limbic system in the brain. And that too gets trigger happy, right? There's receptors up there for cortisol and adrenaline. It affects neurotransmitters and all that stuff. So really, is it brain signaling? Yes. Is it HPA axis? It's really all of that. And there's no great way to find out. And I don't think anybody has only one. Like you have, you just have glucocorticoid receptor hypersensitivity and not these other problems. I mean, they tend to all come together. At least that's what the research shows. That's what I found as well. So it's a little bit of all that. Awesome. Trinette says, I have become so light sensitive, motion sensitive, heat sensitive. What causes this? Can you please suggest a supplement to help? Okay, well, Trinette, there's no magic supplement that fixes that sensitization that you have in your system, but it is a very real thing. You are absolutely not alone. There are multiple causes for this. I was talking about the limbic system sensitization that happens, which if you Google it or look in the research, called central sensitization, central nervous system. Well, it turns out the entire nervous system is actually hypersensitized by stress hormone and, kind of trigger happy, even our sensory nerves. So many of my patients will come in and they'll say, Doc, I'm kind of sensitive to these bright lights and loud noises and harsh chemicals and smells, even touch. Like you could touch one of my patients and their system registers that as pain. So that sensitization happens in a very strong way. The heat sensitivity is a little different. That has to do with the autonomics. It has to do with the adrenals and sodium levels and blood volume and things like that. But that too will come as well. There's no magic supplement to fix all of this. It takes addressing it in this kind of more holistic, kind of comprehensive way. That's really what it's about. We have to know kind of how we got to our broken stress response system. And then we've got to figure out, and this is kind of what we do within the programs that we have, we've got to figure out what your therapeutic puzzle looks like, right? We all have a bit of a different therapeutic puzzle. What does yours look like versus somebody else's? Now, what I would suggest is the way to kind of move ahead is have a conversation. So I've got patient coordinators, right, who you can get a free consultation with to have a conversation about what's been going on with you, what makes sense, and they can talk a little bit about kind of what we do and how we work towards fixing this problem. So I would say reach out to us. I mean, it sounds like you've got a lot going on. No magic supplements, unfortunately. I don't blame you for asking, but they don't exist. So just reach out in the comments, and they can set that up. You'll get a link as far as that goes. And by the way, this is all fixable, right? All that stuff, that central sensitization, that's all fixable. It really is. You can fix it. I mean, you got to hit it from a variety of angles. I know I don't want to paint this kind of gloomy picture like, wow, there's a lot that goes on, but it is fixable. And it just takes a little bit of guidance, right? It takes a little guidance, a little support, changes to things, some lifestyle stuff, some dietary changes. And of course, I do use supplements to work on fixing this as well. All fixable. All this is fixable. Okay, all my best. Carmela says, is frequent urination or frequent UTIs a possible symptom of having adrenal fatigue? It is. My blood test was low in cortisol a year ago. Haven't rechecked since then. Well, if it was low a year ago, it may not be low, but you definitely have some degree of adrenal fatigue or a broken stress response system. So chances are it's still there. I'm 70, and this has been going on for years and getting worse. Okay, so believe it or not, the frequent urination and frequent UTIs could be two separate issues. Frequent urination is very common with anybody with adrenal problems. There's another hormone. The adrenals make, 30 some or more hormones. Cortisol is the main one that we talk about, but one of them is called aldosterone. And aldosterone's job is to help us to hold on to salt. And in the body, water follows salt. So if your adrenals are weak and you're low in salt, you can't hold on to water. Guess what? We pee it all out, and we pee often. That can also compromise blood volume, right? Because blood volume is mostly water. So oftentimes that'll contribute to some lightheadedness or orthostatic issues that a lot of my patients will have as well. Now, the frequent UTIs, and certainly you can have frequent urination if it's connected to a UTI, but frequent UTIs will come more so from mucosal membrane damage that also occurs with stress over time. That's been well documented. And mucosal membranes are, they're everywhere in the body, believe it or not, but mainly GI, respiratory, and genitourinary. And they all take a hit from stress hormone. The protective lining is damaged, and now our tissues are more vulnerable. So this kind of connection with like stress causing ulcers or contributing to ulcers or gastritis or things like that a lot of my patients will deal with. It's a similar kind of a thing. So it's that underlying stress physiology is making you vulnerable or contributing directly to those symptoms. Now that's all fixable. Doesn't matter to me that you're 70. I've had patients older than you. Currently I have patients older than you. I've got patients in their 80s right now. It is fixable, even if it's been going on for decades. You can fix it. You just have to target it in the variety of ways that we've been talking about. Okay. Carolyn. Hi, does adrenal fatigue cause joint or muscular pain? It could. Caroline, a lot of people will ask me, like, is my such and such contributing to or being caused by adrenal fatigue? And the answer is maybe. It's hard to say. The best way to understand is actually to look at adrenal fatigue as a whole. So on my website, which will be posted, my team will post that in the comments below. There's a symptom assessment tool on my website where you just plug in your information and what's going on with you, answer a few questions, takes 4 or 5 minutes, and it'll spit out kind of the likelihood of adrenal fatigue and give you some more information, with some specifics as to kind of how you filled out the assessment tool. It's a great place to start because really with adrenal fatigue, it's this idea of if it looks like a duck and quacks like a duck and walks like a duck, it's probably a duck. And but can it contribute to this one symptom? I mean, the answer is maybe, but certainly many of my patients have pain of all kinds for all different kinds of reasons connected to adrenal issues, whether it's inflammatory issues or sensitization issues, or the fact that stress over time causes muscle tension or it causes mineral deficiencies, magnesium. So there's a lot that can contribute to those issues contained in adrenal fatigue. Renee says, is it important to get cortisol down before starting to take adrenal capsules with adrenal cortex extract? Yes, it is. It is. One of the things I've discovered in doing this for so long is that you really, really want to calm people down first before you support them, right? So if cortisol levels are high, chances are that is a situation where you are in an active stress response. You are not calm at that time. If you support too quickly, you can often overstimulate people. And adrenal cortex is one of the tools that we'll use, among others, as a direct adrenal support. So calm first, then support. Not perfect, like you don't have to have somebody perfectly calm and chill before you can offer support, but you want to see that kind of trending. And then, you want to incrementally kind of add supports, adrenal cortex being one of them, things like licorice root or pregnenolone. There's a variety of others that can help as well. So that idea, you're right. You're right. You want to calm. Calm is always key, right? Because when our system is calm, we are more so out of fight or flight and into that rest and digest parasympathetic physiology. And that's where healing happens. I don't heal people. Like your bodies heal themselves. Our body's been healing themselves for thousands of years, but they're not going to if they think there's a tiger in front of them. Like when there's a tiger, we're geared up for fight or flight survival mode, right? We're going to battle. We need energy. We got to crank up our heart, lungs. It's causing all kinds of damage, right? Healing and repair is over here. There's no time. Don't waste any energy on detoxifying things or getting rid of cellular debris or fixing wound healing and all that. Forget about that stuff. There's a tiger, right? We've got to shift that physiology. And once you do and do so more and more effectively over time, that's where we heal. That's where we heal over time. So it can happen. Okay. Gradimir. Hello. Hey, Doc. I figured out, unfortunately, on my own by doing saliva test that cortisol is dysregulated. So basically my curve is inverse. And recently by doing blood tests for cortisol in the morning, almost on the low range. Am I in big trouble or could I escape this? Lately feeling like, feeling not well, feeling like crap, I guess, fatigue, tiredness, aches in the muscles and joints. No, you're not in big trouble. You're not in big trouble. You have adrenal fatigue. You have a stress response system dysfunction, a fixable stress response system dysfunction with guidance, right? With proper assessment, not blood cortisols. I don't find are great for this. The salivary cortisols, that inverse relationship that you were talking about, is one of the most common patterns that we'll see. So just for everybody else, the best way to test for this is to do saliva testing, where you can get multiple cortisol levels throughout the day. And that's important because cortisol contributes to your circadian rhythm, right? It should be nice and high in the morning, get us up and animated, ready to tackle the day. And then gradually it should go down throughout the rest of the day at its lowest level in the evening when we go to sleep. Well, when that's dysregulated, it's pretty common for that cortisol curve to flatten out. Low where it should be high, high where it should be low. It's fixable, right? You can fix all that, but you've got to target, again, not just the cortisol, not just the HPA axis, the limbic system, all of that together. So you absolutely can get ahead of it. I'm sorry you're not feeling well, but there's answers. There's absolutely answers. Welcome, everybody. I'm watching our numbers go up. Let us know where you're from. We're very curious as to where people are reaching out to us from. We've got patients all over the country and all over, and international patients as well. So, okay, next question. Debbie says, is there any alternative safe way to treat hormone receptive breast cancer without going through second menopause? Don't like taking that. I'm not going to be able to answer that one. I'm not a breast cancer doctor, but there are many functional medicine doctors out there that are, and there are a lot of options. So I would encourage you to keep looking for sure. Maria says, what about elevated cholesterol diet and menopause? What are your thoughts on balancing and lowering cholesterol? I don't balance and lower cholesterol. Cholesterol takes care of itself. Every one of these adrenal hormones I've been talking about is that these hormones are all made from cholesterol. So one of the number one reasons for cholesterol going up is actually stress. As soon as we get stressed, the liver gets that message and says, okay, we need to make stress hormones. So I better make cholesterol. Let me throw it onto an LDL, get it to the adrenals, so the adrenals can make cortisol so we can, live to fight another day. So the problem is not the cholesterol, right? The cholesterol, again, is like this check engine light that goes on. You don't want to artificially suppress cholesterol. And if you look deeply into the research on cholesterol and the lipid hypothesis with cardiovascular disease, it is so incredibly thin. If you're actually concerned about cardiovascular disease, there are many other markers that'll give you far more information than just a straight cholesterol. I know conventional medicine is still hung up on lowering cholesterol in everybody. If we did what they told us to do, whether it's the GPs or the pharmaceutical companies, probably half the country would be on some kind of cholesterol lowering medication. There's all kinds of problems with that. Cholesterol is like this innocent bystander within cardiovascular disease. We got to look at oxidative stress. We got to look at inflammation. There's a couple ratios. You want to look at triglycerides. Make sure triglycerides are nice and low. Make sure HDLs are high. Those markers are far better than just a cholesterol. What about elevated cholesterol diet and menopause? So diet, there's a very specific way you want to eat. If you've got adrenal issues, you want to eat more of a hypoglycemic diet, which causes which puts less stress on your adrenals and cortisol to balance your blood sugar. And as far as menopause goes, menopause is a very interesting time for women. I generally don't have to tell women that, but it's a challenging time for the adrenals because it's the adrenals' job to ease you through menopause. Now that's kind of a big, long conversation that we can have. I think I'm sure I have a video on it on YouTube. If you click over to there and you take a look at the connection between menopause, that time is extra stress for the adrenals. So I would kind of add that to the bucket. And it's not that menopause causes adrenal fatigue. When you have adrenal fatigue, you're set up for menopausal issues, right? So that's the big thing. And I should say that we'll put a link to there's a cookbook that I wrote with a brilliant team member of ours, Jermaine Coaxum, who has integrated nutrition degrees and coaching degrees. She's phenomenal. We wrote a book on the hypoglycemic diet and the way to eat if you have adrenal problems. So we'll put that link in the comments as well if you're interested. Okay. Karen says, with vitamin D being so useful for adrenal health and the thyroid, and I would say everything else, Karen, vitamin D is needed for every cell in the body. What can you do if your adrenal fatigue is making you hypersensitive to supplements such as vitamin D so you can't increase your very low vitamin D levels? Okay, so vitamin D is really important for all of us in general. And most of the country, once we started testing vitamin D levels, we find out that most of the country is actually pretty low in vitamin D, unfortunately. These fat-soluble vitamins. Part of the problem is we aren't allowed to go out in the sun anymore. You want to get adequate sun, not too much sun, but you want to get adequate sun. We've evolved with the sun. It's okay. Even if we go out in the sun, we slather ourselves up with stuff that blocks our ability to make vitamin D. The other thing is, you can get vitamin D in food, right? But we're not supposed to eat those foods because those are like foods with saturated fat and animal foods. So we're not supposed to eat those, which is really a crock. So if you're sensitive to supplements, a lot of my patients are, then you want to get it from food, right? Get them from food. Fatty fish will do it, salmon and sardines, things like that. You can get it in dairy and eggs, even organ meats. One of the ways I assist vitamin D levels is with cod liver oil. So taking cod liver oil is going to give you a natural form of vitamin D, which can get it. Hopefully you can tolerate. A lot of people will not tolerate the supplements, which have synthetic vitamins, but they can tolerate those things in food. So if you just kind of Google a list of high vitamin D foods and do those, not fortified foods like, I don't know, I haven't eaten cereal in a while, but the only reason cereal has any vitamins is because it's like they stripped it of all its vitamins as they put it through high heat and high pressure to make the little O or flake or whatever. And then they spray it with vitamins afterwards. That's fortifying. That's not healthy. I would question whether that should even be called food. But if you Google one of those lists and check that out, that's, that would be useful for you. So it'll help. It'll help. Raising your vitamin D is not going to fix everything, but it makes it easier. Greases the wheels, I suppose. Okay, Dirk says, hello, Dr. Neville. Do you or your patients have experience with stellate ganglion block? I tried it. Unfortunately, there's only short effect, no lasting effect on the autonomic nervous system. Does it need to be repeated more often? Thank you. So I've had patients do all kinds of therapies before they end up with me, whether it's a stellate ganglion block. So for everybody, stellate ganglion's up in here. It's part of your sympathetic or fight or flight nervous system. And, there's a procedure to kind of use some kind of injection, liveq&A, I think, or something to block the stellate ganglion, which some people have had benefit from. It's been hit or miss. I have had some people notice temporary effects, no effects, a couple adverse reactions. I think it has been repeated at times. The thing is, what the stellate ganglion block does, even if it does work, is it only takes care of one part of this whole stress response system dysfunction, right? So if you block your sympathetics, but your limbic system is still constantly yelling fire, right? You're going to it's not going to last, right? So there's just a lot more to it. I think it's it's just a very superficial way of treating most of the time. So Wanda says, how can I improve my below normal cortisol levels of all day? So hopefully I have enough energy. I'm 68. So improving cortisol levels, right, is a concern and a very real issue with patients. We improve cortisol levels by, of course, it's by fixing this whole problem, right? Part of the reason our cortisol levels might go low is because of excess demand over time. I mean, picture yourself, you're a zebra in the wild running from a lion. I mean, how long is that chase going to last, right? 30 seconds, maybe a minute if you're a really fast zebra. And then if the zebra gets away, it goes and curls up under a tree for a day, heals, repairs, and goes and grazes again. Most of us have been running from that lion probably not 30 or 60 seconds, right? Maybe not even 30 or 60 days, maybe 30 or 60 years. And it depletes our body, not just of cortisol, but of B vitamins, antioxidant status, of minerals, mitochondria. It causes all kinds of problems. So it's not quite as simple as, hey, you're low in cortisol, I'll just give you cortisol, or you're low in cortisol, I'll just give you vitamin C or something like that. We have to decrease the demand. We have to shift that physiology and allow the adrenals to heal over time, which they absolutely can. And I've got, just I'll share, I've got multiple programs that we use nowadays. And the way I used to treat patients was that people would come stay at our guest house, and they would work directly with me or with my predecessor. They'd come from all over the country, a couple weeks, couple months to get treated for this. Now, by the time I would send them home, they were feeling better, not fixed. You do not fix this problem in 8 weeks. It's been there likely for decades, but they're shifting and they know what that means. And then by the time they leave, they've got a plan. They understand the plan. They got tools to implement the plan, right? So not only would they feel better quicker, but they would stay better longer. Now that's the goal, right? Is to understand what you're dealing with, get ahead of it, know how to manage it, and go live your life. Stay away from as many doctors as you can, including me. Now, the problem with that is most people don't have the resources to come hang out with us for a couple months to get that level of care. So I've had a couple different programs that I've that I've run, and I have two main programs that I use nowadays, which is a program that's run by my coaches and a program that's run by me. Both are identical. Both include the information that I've documented over the past 8 years. I've written down and recorded every bit of advice I've given to any of those patients who used to come and stay with me. I've got it all documented in, 40 to 50 different educational modules, and it's all there. That information is included in those programs. And if you have any questions or you want more information, so you can do that. But this is fixable, right? And what I mean is, reach out in the comments if you have any more questions about that, or if you want to talk to our patient coordinator again, reach out in the comments and we can try to guide you with that. We tend to do this fairly well. I will say one of the benefits that people would get within those programs, like they got when they came here, is that they got the guidance and support they needed. When people were here for a couple months, they're in my office every day. We're having conversations, right? There was no stone was left unturned. I mean, we got a lot taken care of. And so they got it. By the time they left, they got it. They knew what to do. They knew how to do it. And that just takes some guidance. It takes some guidance. But I have documented all of that for people that are somewhat self-sufficient in that way. Brianna says, I've been on birth control that contains estrogen for over 10 years. Can the estrogen cause me to have high blood pressure now? Yeah, it can. I mean, there's some research on oral contraceptives and estrogen in contributing to high blood pressure. There's plenty of other reasons too, though, right? Not to mention the fact that, if you're on birth control, if you're on birth control for birth control, that's one reason, right? A lot of women are put on birth control because their ovarian hormones are off, because their periods are off, right? Because they have heavy bleeding, or because their period comes too often or comes too little, or, to modulate their hormones. Well, the number one reason why those ovarian hormones go off in the first place is because stress physiology messes with ovarian hormones. Well documented. We know that excess cortisol over time suppresses the hypothalamic pituitary ovarian hormone axis, throws off the balance between estrogen and progesterone, usually tilted towards estrogen. So women feel estrogen dominant, we call it. Heavier periods, worse PMS, moods, spotting, bleeding in between, could be fibroids, endometriosis. It's a very common pattern. So it's possible, right, that adrenal fatigue is contributing to the need for the birth control pills and the hypertension as well. The way to know would be to go to my website. I mentioned it before, a symptom assessment tool that we have on the website. Punch in your symptoms, 4 to 5 minutes. It's real easy to do, and it'll spit out some information. So reach out. We can provide that, get that to you in the comments below. Okay, so Michelle says, how do low progesterone and low estrogen affect high cortisol levels? Will regulating estrogen and progesterone help to get the cortisol down? Michelle, I'd suggest it's the other way around based on exactly what I just said. That's the way to go. I used to think of the adrenals, the ovaries, and the thyroid as kind of a three-legged stool. That's kind of how we're taught. That's not how it works. The adrenals call the shots. Stress physiology and adrenal issues suppresses ovarian and thyroid function. Well documented. So if you have problems in those glands, you've got to check your adrenals. All right. Okay, so I want to announce, I want to pause, right? And I want to mention that we have a summer special. I was just telling you about those programs. So we're offering something new. So what this is an appointment with me with a test and free access to what is my core program, right? All that information I just talked about, that 40 to 50, all that education library, you can get that as well, all that together for $922. If you're on this event today, $922, and that's about $1,200 bucks, right? So that's looking at like a $300 savings for that now. Right. So do that. I think that there's a coupon code. Reach out in the comments if you're curious about that. That will get you started. So what does that get you? That gets you a conversation with me. We'll talk about your history. We'll kind of figure out how this started. get you started moving forward. I can make some specific recommendations. We'll have the test. We'll be able to go over the test. I've seen these tests misinterpreted numerous times. And you get all the guidance, maybe not one-on-one with me multiple times like in our programs, and we still do that for people that can do that, but a lot of people can't. By all means, that's an incredibly good deal. That will get you started in a really significant way, because you can have me with you in that educational library. That coupon code expires in 7 days, I am told. So summer special, reach out in the comments if you're curious. Lisa says, can adrenal fatigue cause nervous shaking in your arms and hands, as well as feeling nervous pit in your stomach? 100%. I'm 43 years old, pretty sure I'm in full-blown perimenopause. My anxiety has been exacerbated by stress for the last few weeks, and now I feel like I'm just stuck in a perpetual state of fight or flight. So if you're stuck in fight or flight, you have adrenal fatigue. Again, adrenal fatigue is a bad name for this condition. It is really a dysfunction within your stress response. And we mentioned earlier, if you go back to the recording, if you missed it, that I think we talked about this. I don't know, I say this stuff a lot, but the adrenals help a woman through menopause, right? So you're 43, that's a little young to be in perimenopause. Chances are that's the situation because of that stress physiology, which is broken. And again, this is all fixable. You just have to hit it from a variety of angles. That's the biggest thing. You can fix it. And the concepts are fairly simple. Maybe some of the things aren't the easiest things, but when you make incremental changes, right, and work on the bucket, right, create space in the bucket, get that physiology to shift, it can shift, and it incrementally shifts so that you can go through menopause with grace. It absolutely can happen. And if you're overwhelmed by all this stuff, I know I talk, I don't know, sometimes I'm trying to educate and help, and it feels kind of daunting and overwhelming, all this information. You can reach out. I have a patient coordinator who would have a free consultation with you, talk that through with her. She's one of the most compassionate people. She hears these stories all the time. She gets it, and she can help to guide you on options moving forward as well. Camilla says, you've mentioned low blood pressure as a symptom of adrenal fatigue. Is high blood pressure also a symptom? Yes, blood pressure tends to start out low, but it can go high over time. All of your stress hormones are vasoconstrictors. Dump too many vasoconstrictors into your blood supply over time, and those blood vessels eventually, they can't kind of vasodilate quite as much over time. So the fact that hypertension is caused by stress, 100%. I mean, every doctor knows that. Yes, it does. Irene says, can your protocol be followed while taking conventional drugs, methotrexate for RA, rheumatoid arthritis? Absolutely, it can. In fact, the underlying cause of your rheumatoid arthritis very well may be stress physiology, which has suppressed the immune system. Very predictable things happen, including a tendency towards autoimmune diseases of all kinds. In fact, I mean, I see autoimmune in my practice all the time, and I've never seen somebody with an autoimmune disease who didn't have this underlying adrenal problem that's contributing to it. So there's a chance actually to get ahead of that. Depends on the damage and all that stuff that's happened. But regardless, yes, you can move forward. Sherry says, why does my menstrual cycle become very unregulated when I take certain adaptogens to control my heart palpitations, especially ashwagandha? Any recommendations on which may not affect my cycle so much? Well, here's the funny thing, Sherry, I don't use adaptogens in my practice. Adaptogens for everybody else are herbs that help us to adapt to our environment, ashwagandha, holy basil, rhodiola, ginseng, things like that. I find that they're problematic in a lot of my patients. Why exactly they're contributing to your problem is hard to say. I just tend not to use them. I think you can use them in very mild disease or in people who are healthy or who are just a little stressed out. You can use them successfully. I thought I'd use them a bunch. I was trained in herbal medicine, but it turns out they cause problems in most of my patients. So I don't tend to use them. Okay, Brian says, I suffer from adrenal fatigue as a result of lifelong PTSD, traumatic brain injury, heavy metal toxicity, late-stage Lyme disease, undiagnosed 10 years. worse, inappropriate use of antibiotics. I get it. Live from a wheelchair on a budget of $1,000 a month. How does someone in my situation access holistic health care? Well, if possible, maybe consider that summer special. I mean, you would get all of that and, pretty explicit guidance on how to move forward. Plus, plus you would get that core kind of educational materials. That material is also, we're working on preparing that as a standalone as well. And I have a wait list for that. So if you reach out in the comments, Brian, we can put you on that wait list. So when that's available, we can discuss that. So we're putting that together to try to get that out to people as well. I get it. I hate that people can't afford to get care that they need, but hang in there. There are options. And that is certainly one of the low cost options. Mark said, I saw your video on sea salt in water. I tried that, became wired and slumped. Am I too sensitive? I'm early in my recovery and seemingly sensitive to everything, even supposedly calming supplements. Yeah, Mark, if you could only use one word to describe those of us with adrenal fatigue and this stress response dysfunction, sensitive would have to be that word. So you want to listen to your body. I'm not sure. It sounds like you're trying to kind of do this on your own, and certainly more sensitive people need a little more guidance. Listen to your body. That's the key. Listen to your body. Nothing should wire you. Maybe you try salt in food, and that's okay, right? Don't do it in water. Just do it in food. Just keep experimenting with those things. And again, if you need more specific guidance, we're here. Just reach out. You can reach out in the comments. Denise says, please discuss sleep and exercise and adrenal dysfunction. Or adrenal function. So adrenal issues causes insomnia as one of those kind of key symptoms, right? Stress does that. So we see sleep issues all the time. And it is one of the things we do target, not necessarily chasing after the sleep, but chasing after fixing the underlying problem, which gets people to sleep, which gets people better faster. Now, exercise is a challenging one, right? Because exercise is incredibly healthy for all of us. We all need to move as much as possible. Except people with adrenal fatigue are generally tired, their functional capacity is too low, and it's real easy to over-exercise. I mean, some of my patients are over-exercising just doing the activities of daily living, right? We have to acknowledge that. And you have to stay under that threshold for a while until that threshold increases, and then you can start to increase and incrementally get better. Exercise is a stress on the body. It's a good stress. As long as there's room in your bucket for that stress, it's a good stress. If there's no room, then sometimes temporarily we have to leave it out until people are ready. And we've got to make that judgment call as to when we can do that. Michael says, how do you deal with true diagnosed adrenal suppression? There's a lot to that question. It's hard for me to kind of address that, just kind of one-on-one. I mean, I'd have a consultation to find out exactly what you're talking about with adrenal suppression, steroid use or whatever. I mean, I've got patients on steroids. I've got patients with adrenal failure, primary adrenal insufficiency. So, I mean, I've got patients who have, diagnosed adrenal problems as well in my practice that we do with our programs. So sorry, I can't be of more help that way. Eileen says, I have excessive sweating in my head, down the rest of my body. When I do nothing, I'm fine. Walking in a store, I use a sweatband. Sometimes I have to change the band multiple times. I'm diabetic and I have Hashimoto's. If you're diabetic and you have Hashimoto's, chances are you do have adrenal fatigue. You might want to reach out, right? Reach out, have a conversation with my patient coordinator. Reach out in the comments, and you can have a conversation because that's fixable. Hashimoto's, again, for everybody else, is an autoimmune thyroid problem. Never had a patient with Hashimoto's who didn't have an underlying adrenal problem. Never. The adrenals suppress thyroid function, or cortisol, right? Stress suppresses thyroid function. Stress suppresses immune function towards autoimmunity. So it makes sense that could happen. Sorry, I'm speeding up. I'm running out of time. Linda says, fatigue. How can you tell if it's from being acidic or low blood sugar or body mind is tired? Well, low blood sugar is going to be associated with the adrenals. Body mind is tired, potentially associated with the adrenals as well. I don't get into acid-base balance too much. When I look at the research and I look at some of these doctors that have kind of assessed populations, it doesn't really matter all that much. Certainly, acidity contributes to disease and dysfunction, but guess what makes us acidic in a very significant way? It's that stress physiology. So there's a lot to it. Again, I would say symptom assessment tool, look at the fatigue, but look at it in combination with the rest of the symptoms to see, does this adrenal fatigue make sense? I mean, that's the best way to do it. Sonali says, how can we pinpoint our health issues, brain fog, and fatigue? Same answer. Just go to the symptom assessment tool, see if it makes sense. Truly, looks like a duck, quacks like a duck, walks like a duck. We kind of know what we're dealing with. Okay, Leah says, from your post on vitamin D, the last time I had my D levels checked, I was crazy high. Last few years, I've only taken D supplement during less sunny months. Is that a good approach? Great approach. I tend to use check vitamin D after the spring and summer. How much vitamin D are you taking? How much sunlight did you get? Get a test. Then go through the winter and fall. How much vitamin D are you taking? How little sun are you getting? Take a test after the fall, before the spring, and then you can kind of titrate in how much you need. We might make it. Jane says, I'm a 50-year-old patient that has tried to implement all of your advice, including rest. Take it easy and be careful of over-exercising more than gentle walking. However, my adrenal glands were removed due to Cushing's, and I've already been on hydrocortisone for 23 years, will be for the rest of my life. I feel I need to lift weights to help with the bone loss. Please advise if I can do this. I'm not your doctor, Jane. I can't tell you whether you can or you cannot. Just remember, exercise is a stress. You're on replacement hydrocortisone. Just pay attention. Listen to your body, right? That's really the way to do it. And certainly, I have patients who have no adrenal glands. I have patients with primary adrenal failure. I consult with those patients all the time. So, Prozac for adrenal fatigue. Saif says Prozac for adrenal fatigue. It's covering up a symptom for the most part. There are other issues. Temporary use of antidepressants, anti-anxiety meds is very, very common in all my patients. I mean, that's how conventional doctors look at it, right? They're like, let me cover up this symptom and this symptom, right? What they don't then pay attention to is the underlying problem. And if you just cover up symptoms, you're not going to fix the underlying problem. It's going to get worse over time. Temporary use, okay, right? But fix the underlying problem. And it really is absolutely fixable. It is. So you'll find that this stress response system dysfunction, which has no good name, we'll call it adrenal fatigue for the lack of a better term. Even that is not a great term. But the stress response system dysfunction is connected to a ton of dysfunction, a ton of things that we deal with as a society in general. Look at anxiety, look at depression, look at all the blood sugar issues, metabolic problems, weight, hypertension, cardiovascular disease, neurodegenerative diseases. All this stuff is fixable, but we are overly vulnerable to all of those things when our stress response system is broken. Fix that stress response system. When you fix that system, now you put yourself in an anti-inflammatory state because you're turning on healing and repair. Now you're in an anti-cancer state, an anti-aging state. Honestly, there is no more powerful, I would suggest, program or no more powerful goal that we can do for our health and our well-being, but to balance out that physiology. It's incredible. Now, I will say, lastly, I can't wait to meet those of you that take us up on this summer special. So basically, that summer special, save $300. You get a test and an appointment with me and that complete video library that can guide you to healing this adrenal problem for good, learning how to keep it at bay so that you can get back on your feet and get your life back. Take advantage. That coupon thing, they say, expires in 7 days. I just have limited spots. I mean, that's the issue. I've got limited spots. So, if you want some help, it's okay to ask. Okay. All my best. We'll do this again in 2 weeks. Take good care. Bye.